There is a lot of promise in the application of artificial intelligence, AI, in healthcare. AI in healthcare improves patient diagnosis, boosts cost effectiveness, improves prevention and treatment, and helps ensure that everyone has fair access to care. According to a survey conducted by the Pew Research Center, 38% of patients believe that utilizing AI for disease diagnosis and treatment recommendations would result in improved health outcomes. Market forecasts indicate that the global market for artificial intelligence, AI, in healthcare is anticipated to reach $12.63 billion by the conclusion of 2023. Furthermore, this value is projected to further increase to a remarkable $187.76 billion by 2031. The AI investments in healthcare this year have experienced a significant surge. The UK government allocated $17 million in March 2023 towards AI research aimed at enhancing cancer screenings, diagnosing rare diseases, detecting high-risk women for premature births, and improving the overall speed and accuracy of diagnoses. In September 2022, the NIH made a public declaration of a $130 million investment spanning 4 years to improve the utilization of artificial intelligence in medicinal and behavioral research. Welcome back to our channel, where we spread awareness through making content related to the latest medical breakthroughs and sharing some stories of medical miracles with you. In this video, we will discuss the big breakthroughs in artificial intelligence and healthcare over the past year and predictions of what we should be looking for in the year ahead. 1. Smart bandages. A bandage that utilizes sensors to monitor wound healing has been created by researchers in the US. It promotes faster closure of wounds, increases new blood flow to injured tissue, and enhances skin recovery by significantly reducing scar formation, according to the Stanford University team behind it. A tiny electronic layer on the bandage incorporates temperature sensors that monitor a wound. If necessary, they can trigger further electrical stimulation to hasten tissue closure. With stimulation and sensing in one device, the smart bandage speeds healing, but it also keeps track as the wound is improving, said Artem Trotsyuk, co-author of a study of the bandage. The device needs to solve cost and data storage concerns before going into mass manufacturing. However, it could potentially offer major benefits to patients with weakened immune systems and disorders like diabetes, who typically suffer from slow-healing wounds. 2. Freenome, next-generation early cancer detection. Freenome is a cutting-edge technology that employs AI to generate healthy settings for an individual based on their cell-free genome. The business is redefining early cancer detection using next-generation blood tests driven by a proprietary multi-omics platform that combines deep molecular biology understanding and machine intelligence. Freenome's ultimate goal is to uncover the early warning indicators and provide accessible assays to diagnose cancer in its most treatable stages. They also engage with health systems to integrate actionable insights and build a feedback loop between care and science. 3. Improving patient communication and engagement. AI chatbots and virtual health assistants are proven to answer patient queries, deliver information, and offer support as well, if not better, than humans. A study conducted by NYU researchers investigated the possibility of employing ChatGPT or LLMs to answer the vast inquiries within electronic health data. The researchers discovered that patients could not distinguish between AI and human-generated answers, implying that LLMs can be beneficial in expediting patient contacts. AI receives strong bedside manner marks as well. Research published in JAMA indicated that responses from ChatGPT were actually preferred to those delivered by a physician about 79% of the time, and were judged considerably higher for both quality and empathy. 4. Nico Health, AI-powered comprehensive body mapping. Nico Health, a Stockholm-based firm, has invented a novel approach in medical scanning technology. This technique leverages AI and the newest sensor technologies to provide non-invasive and economical examinations, body scans, to collect full health data for patients. In conjunction with clinicians, academics, and universities, Nico Health develops medical technology that can enable a new style of treatment. With Nico's body scan service, more than 70 sensors are used to obtain detailed health data. This whole body mapping method acquires and analyzes over 50 million data points from a person's body. It provides a complete picture of their cardiovascular health, skin spots, and birthmarks, allowing patients to identify and track individual risk factors and monitor overall health. 5. Ambient assisted living. Ambient assisted living, AAL services, integrate technology in a person's daily life to assist them live independently. Several AAL devices have been devised and developed based on sensors, microphones, and vision systems with pretty promising outcomes. However, for the area to attain maturity, several obstacles need to be solved, including building strong processes in the real world that are easy to use and accepted by society, users, and caretakers. Because of this, researchers are seeking to detect infrequent abnormal events using merely a standard camera system. Pose estimation models are used to detect a person in the image and extract the body key points. The procedure is commonly called skeletal detection, whereby the position of the person's skeleton is established merely from the picture. This information is vital to detect anomalies, such as someone lying asleep on the ground. Initial experiments indicate very impressive findings with the system capable of detecting the majority of the irregularities. These results also reveal that these methods compare quite well with other commercial sensor-based systems, which are far more expensive and inaccessible for most individuals. 6. Automated gait analysis. Gait analysis is the systematic study of walking patterns which generally utilizes expensive and intrusive marker-based methods in conjunction with many infrared cameras. When combined, they create kinematic data that precisely measure the walking behavior of a person. Once the data is obtained, specialists next evaluate the implications from the kinematic data to make diagnoses. On the other side, this project developed an automated alternative to marker-based approaches for gait analysis utilizing standard cameras and AI. The method achieves kinematic data that comprises variable left and right joint angles for hips or knees. Two video cameras pointing at the side and front view of a walking subject record this information. It then employs pose estimation as a markerless type of motion capture, which feeds into a pipeline of algorithms for calculating and processing kinematics. The automated method is highly promising since it gets results practically identical to that of an expensive marker-based system. Thus, it decreases the labor and financial commitment needed for gait analysis, leading to a greater dissemination in the healthcare community. Furthermore, since such a system would theoretically run with just 2 mobile devices, it would make it perfect for usage in rural places worldwide where the availability of expensive equipment is impossible. 7. 3D printing. The usage of 3D printing technology in healthcare is rising significantly. More than 110 hospitals in the U.S. had facilities for point-of-care 3D fabrication in 2019, compared with just 3 in 2010, according to statistics given by Statista. The technology is being used for manufacturing dental implants, replacement joints, as well as for made-to-measure prosthetics. Research into employing 3D printers for creating skin tissue, organs, and even pharmaceuticals is also ongoing. One of the key benefits of 3D printing is that it substantially accelerates production processes and, consequently, also reduces the cost of traditionally created products. The technique has cut the time it takes to make hearing aids from more than 1 week to only 1 day, according to the American Hospital Association. 8. Interpreting and diagnosing. One of the most significant advantages of AI in healthcare resides in its capacity to boost diagnostic speed and accuracy to support clinical decisions. AI swiftly processes enormous volumes of data, helping healthcare providers to diagnose and treat diseases more effectively, and delivers evidence-based suggestions to assist them make well-informed decisions throughout patient care. Radiologists are adopting natural language processing, NLP, to complement their work and improve the interpretation of scans. By studying X-rays and MRIs, AI identifies patterns and anomalies that may be overlooked by humans, leading to earlier and more exact diagnosis. The president and CEO of imaging at GE Healthcare, Jan Makila, says that they acquire images 30% faster, with improved quality and resolution owing to AI. 9. Schizophrenia. Virtual reality. An issue in teaching healthcare staff about schizophrenia is that it is hard for them to understand what patients feel. This research uses AI in a VR simulation to immerse the users in a virtual world and assist them experience the symptoms that such a patient could feel. The simulation comprises numerous easy tasks, which the user does while confronting obstacles associated with schizophrenia in the form of visual and oral hallucinations. AI is applied to the interactive narrative to allow the tale to react to the user's activities, thus boosting the experience's immersiveness. Various mental health nursing students tried the event, and it was well received. It managed to raise their awareness and generated empathy for persons suffering schizophrenia. The next phase in this study is to use it as a treatment environment for the actual patients so patients can confront their hallucinations in a safe virtual context. 10. Improving access to care. AI-driven data analytics equip healthcare leaders with insights into patient demographics so they may identify at-risk groups and enhance care delivery to meet unique community requirements. Chatbots and virtual health aides significantly improve accessibility to healthcare resources. Thanks to AI-powered telemedicine platforms, many patients are obtaining medical consultations and care online, removing the need for physical travel to healthcare facilities and making healthcare more accessible to individuals in remote or underserved areas. Though there are problems to be acknowledged and handled, AI is dramatically enhancing the healthcare scene. Still, we've only just begun to grasp the benefits. The future undoubtedly contains more spectacular AI-based advancements. 11. Cerebral Palsy Assistant. The Smart Clip project supports children with cerebral palsy, the most common physical disability in children impacting movement and posture. The project places the user at the core of the design process by producing a smart device which tries to improve the child's motivation. During the numerous sessions, children sometimes find it tough to do the tasks which the therapist proposes. By converting the therapy into a pleasant game, the researchers aim to receive greater feedback from them. This notion is called gamification, whereby a standard, often tiresome work is converted into a game. Various experiments suggest that gamification is quite effective in varied circumstances. Through this activity, the youngster is encouraged to develop positive behavior and improve his social connections. Why is artificial intelligence necessary? Artificial intelligence technology could be used in several ways: to improve medical care, to enhance procedures through incorporating digital intelligence into medical equipment and instruments, to provide a means of assessing patient records to identify error-causing factors, to propose new treatments in light of existing ones. What is the future of medicine in artificial intelligence? Artificial intelligence, AI, promises to revolutionize medicine, giving us a better understanding of health and disease and the ability to make more choices based on data. It's not that AI will replace the physician, said Carolyn Meltzer Maryland, head of the Keck School of Medicine of USC. It's that the physician who uses AI will replace the physician who does not use AI. In conclusion, AI in the healthcare industry revolutionizes healthcare delivery, diagnosis, treatment, and patient outcomes. Also, AI technologies such as natural language processing, machine learning, and robots can increase medical imaging, customized medicine, drug development, and administrative chores. Despite the bright outlook, problems including data privacy, legal impediments, and ethical concerns need to be solved for widespread implementation and to ensure AI's beneficial incorporation into healthcare systems. If you find value in the content we provide in this channel, give a thumbs up, and please leave a comment down below regarding your thoughts about AI in healthcare. To get the latest updates, kindly hit the subscribe button. Thank you for watching. See you in the next video.